Well, hello and welcome to all of our viewers around the world. I'm Fiona Lang Sharp, IBCLC Director of Communications and MC here at Gold Learning. Today, I'm very excited. We're talking about our Gold Midwifery Online Conference 2026, and I'm delighted to be sitting down with one of our speakers here today, Awube Menlah. Welcome. It is so good to have you here today.
Thank you so much, Fiona. It's quite an experience, and I'm excited to be part of the Gold Midwifery 2026. I'm
Well, it's,
ready to also
yeah.
experience other participants, and yes,
So many things, right? So,
yes, so many things.
yeah, we've had a chance to talk just a little bit offline, and
Mhm.
I want to introduce the topic that you're going to be speaking to, and
Sure.
and I know we'll dive into a few of the things that I know a lot of people ask, about this topic. But the session title is Sterile Water Injections, a Sustainable and Effective Option for Addressing Low Back Pain in Labor. So a really important topic. Many people have heard about this, but can we say that it's probably still not being utilized or it's underutilized right now in practice? And I think that you are here on a journey to change that, my friend. So I'm excited. I'm
Mhm.
excited to hear what you have to say. But your your journey, there's you have a huge experience in so many things: nurse anesthesia, midwifery education. Now you actually did, I'll tell the audience, and what a great achievement, PhD in low back pain, which is incredible, to think that this has been a lot of your life's work. And I know a PhD is a lot of work. I'm sure you're so happy to have graduated, right?
I am.
Well, we're excited for you for sure. But
Yeah.
can you take us back, to when pain management in labor, especially in that low back pain, became something that you felt so deeply about it that it called you to focus on? Tell me that
Mhm.
moment that just changed everything for you.
Thank you so much, Fiona. I must say, I come into this conversation wearing two hats, as you rightly said, and these two different perspectives or hats, they mean so much to me. I'm quite deeply into it. For many years, I have been a nurse anesthetist. I was practicing at the top of my field, confident about pain management, pharmacology, advanced pain assessment, and I needed to make some clinical decisions. And I understood pain from that intellectual perspective. However, I'm also a mother. And so when I became a mother during my labor, I experienced severe back pain. I remember being given a pharmacological intervention. I don't want to mention the name. And I felt out of the experience. I felt drowsy. I wasn't part of the birthing process. And it was something that did not align to my perspectives of allowing the woman to go through the birthing process. So that
Hmm.
was when I began thinking and analyzing and exploring what could be there that can work for women like myself who may not necessarily need pharmacological intervention. And so in that moment, with all my professional knowledge, I still wasn't able to overcome the back pain or the labor pain as expected. And so that experience reshaped my thinking about labor pain in general and what could be done, especially in resource constrained settings like where I come from in Ghana.
Mm.
So that was what was my turning point. And I started reading and exploring, and I chanced on sterile water injections. And that's when I began reading into it and researching into it. And that was the motivation for pursuing that in my PhD.
Wow. Well, what a journey. It's almost like it sounds like you almost had this awakening in a
Yes, it
in a
was really an
sense,
awakening.
right? which is beautiful and heartwarming. It when you spoke to that, I think that, as women in this work, we do often connect it back to ourselves, the impact,
Mm-hmm.
and we have the compassion. Yet a lot of us are educators, and we look at the literature, the evidence, and the research. And then we look at the clinical practice. Like you
Exactly.
said, the experience that you had was not in alignment with what you had wanted or expected. And all of a sudden, things change. So,
Mm-hmm.
it's something I think a lot of us can resonate to. With low back pain and labor, being that it's so common. I mean, we see it all the time, yet often underestimated. A lot of people, you don't hear a lot of, perhaps prenatally, hear it talked about, or, what to anticipate. From your clinical and, teaching experience, what does pain look like for women, particularly in settings where there are limited resources? What is really happening in the conversations, if they are happening? And then in a practical sense, what happens to the woman and the woman's body in that time?
Mm-hmm. Thank you, Fiona. As clinicians, sometimes we are actually tempted to just put pain in numbers. We just
Mm,
look at it from on a scale. How much pain are you feeling?
right.
Um, but I learned something different when I also got pregnant and I became a mother. Ironically, when you look at labor pains, 1 out of every 3rd woman experiences back pain, which means it's not something we can easily ignore. As much
No.
as some women experience the lower back pain, the contraction, back
Mm-hmm.
pain is present. And for most women, they even experience it prior to getting into labor.
Mm-hmm.
So back pain in labor is present, is common, but it is not discussed. It is not highlighted. We always talk about the contractions. I know the contractions comes with its pain, but when a woman experiences the back pain as well as the contractions, it's more overwhelming. And that is when they need the support. And so we need to discuss it. We need to recognize that out of every 3 women in labor, one of them, that's 30%, experiences the back pain in addition to the contraction. And so
Mm.
we need to start talking about it right from prenatal, right from antenatal classes, so that the woman is prepared, especially for those women who may experience the back pain. That in addition to my contractions, it's most likely that I would also experience lower back pain, which with the two, you need to manage it very well. And sterile water injections offer that, especially in settings where we are resource constrained, we don't have a lot of options, and we are limited to using what is available. And sterile water injections are available. In fact, in every hospital, you will get sterile water injections without going through that process of uh, getting permission and getting approval before it is administered. So the conversations must start. And let me add this briefly. In settings like Ghana and other low resource countries, some of these options are not discussed. It was quite novel in my setting. It's because we don't know about it. But when we
Mm.
start talking about it and accept that most women would experience this and they need to have options available to choose from, it becomes more empowering for the woman, knowing that she has an option to choose from.
Yeah, absolutely. I think that, and that, like you said, that there is a solution here. I mean,
Hmm.
there is an option, a solution, that we can move forward with. And so sterile water
Exactly.
injections, I mean, they're simple, but yet powerful
Hmm.
intervention. It's still an
Exactly.
intervention, but it is a powerful one. Can you just tell me what first drew you to this method, and what evidence alongside your own experience can you tell
Uh,
me briefly about, because I know you're going to go into a deep dive during the presentation, but what can you tell me
exactly.
that really matters?
Well, I think what mattered most was when I pounced on that evidence or that study from one of the uh, global experts in the field. That's Nigel Lee's study, where they had
Right.
already done some RCTs confirming its effectiveness. So that was the turning point that, well, if this is out there and it's been used in Europe, it's been used in Australia, why
Mm-hmm.
don't we find out more and see if it is actually something we can implement in my context? And so that was the turning point. We have a lot of evidence, literature to support its effectiveness. And now, NICE in UK have added it to um, the maternity um, um, sorry,
Or
I'm
no,
getting,
no, it's okay.
yes,
Like their protocols. I think I've seen
their
it, right?
protocols,
Yeah,
exactly, exactly, meaning that it is something that women can easily choose from.
right.
Yes.
Yeah. I think, I mean, again, the conversation needs to happen. I think this is part of what you're going to be speaking to.
Mm-hmm.
Before I let you go, can you briefly tell the audience, like where you are in the world and, how you got there and a little bit about your practice now?
Okay, so thank you once again, Fiona. As I said, I started as a nurse anesthetist. I have worked in the clinical setting for almost 10 to 15 years before I came to the educational sector. And when I came in, I was lucky enough to work in the midwifery space. At one point, I became the coordinator for the midwifery program. And so I began working with midwifery students. And that's when I realized that, especially from Ghana, where I have almost practiced all these years, pain management among women is minimal.
Mm-hmm.
And it is high time we begin listening to the women that they also need to be heard. And managing their pain in labor is an important aspect of their journey. And so it was through this search that was what guided me to apply for PhD in Australia. So I came to Charles Darwin University and I began my PhD and research into sterile water injections. I actually did an implementation study where I, for the first time, implemented sterile water injection in one of the biggest hospital, in fact, not one of the biggest hospital in Ghana. That's the
Wow.
Kulibutichin Hospital. And so it was a pilot study. We tried it out there, and the results are amazing. And that's
Wow.
what I want to share with my listeners today or uh, participants that are joining so that they know that this thing really works
Yeah.
and no matter where you find yourself as a midwife, as a nurse, if a woman is in labor, has back pain, you can offer this as a simple intervention that really works.
Excellent. Well, thank you so much. How inspiring. I think that, my takeaway here is, first of all, we have to identify where some of those gaps are in education for our families, for
Mm-hmm.
our
Mm-hmm.
practitioners, and then that there are solutions getting that messaging out. And in fact, there are ways, I think some people get stuck on the point that you actually achieved, and that is how to implement this protocol in a hospital. What does it
Exactly.
look like? And so I am so looking forward to hearing more about that when you come back.
Thank
And
you,
of course,
Fiona.
you'll be speaking live at our Gold Midwifery Conference. So if you can all make it live, that's going to be fantastic. You'll be able to ask questions on site with myself, and Awube are going to be there for our live Q&A. And if you're listening
Thank
to the
you.
recording, well, of course, you'll be able to post your questions in the forum, and we'll be able to answer them live for you as well. So Wube, thank you so much for being here today. It's just been wonderful hearing from you. I can't wait to hear more. And so we've got more coming up very soon. Thank you again.
An honor being here, Fiona. Thank you.
Thank you. And for all of you listening in, you can head over to the website right now at goldmidwifery.com. Check out all the details, including this presentation on sterile water injections, a sustainable and effective option for addressing low back pain in labor. Thank you again for listening here today, and we'll look forward to seeing you all again. Bye-bye, everyone.
Bye.